All right. Well, hey, good morning, everyone. My name is Sarah Johnson. I'm the sales director at Security Health Plan. Work closely with Jeff Tucker, VP of Business Strategy with Marshfield Clinic Health System, as well as many other hats that he wears. I know he's joined you for other webinars in the past. If you could give everybody a quick hello, Jeff.
Hey everyone, it's good to be back, and welcome to Kara, my new co-host for these webinars. I'm excited to work with you. I've heard a lot about you, longtime fan, first time caller.
Awesome, that's great. And also with us today, another first, we have Erin Long joining us. Erin is our Director of Product Development. She has been in healthcare for just over 14 years, and 8.5 of those years have been with Security Health Plan, the other remaining with Marshfield Clinic Health System, assisting on the care delivery side. Erin's going to be talking to us today about level funded coverage. And her goal with this is to really help you understand the nuts and bolts behind it. So what's making up the monthly cost in a level funded plan? What are the benefits of level funding? And how does stop loss coverage play into that whole factor? So it's a nice blend of self-funding and fully insured, but it does have a few bells and whistles and ups and downs, and she's going to tell us all about it today. So I'll turn it over to Erin, but before I do, if you do have any questions, please feel free to put them into the chat or to the Q&A. Jeff and I will be watching those. And Erin, we'll just kind of, if you would give us a pause now and again, we'll just speak up with any questions that come up and take a moment to answer them.
Sounds great.
Thank you. Take it away,
well,
Erin.
All right. So thanks for joining today's webinar. I just want to do a special thank you to Jeff and Kara for allowing me the time to talk about level funded coverage. So with that, we'll go ahead and dig in. Right. So first and foremost, why would you want to choose a level funded plan? So level funded plans are a hybrid of a traditional fully insured plan and a self-insured plan. So they're kind of a mix between the two. What's nice about it is the employer pays the health insurance carrier a fixed monthly cost, kind of the fully insured plan side of it, and that helps to cover the expected claims for the plan year. There is limited financial risk due to stop loss coverage, which we'll talk a little bit about later in the presentation. This is different from a self-insured plan where the employer takes on the full risk. With most level funded plans, there is opportunity for refunds at the end of the plan year. That is included with Security Health Plan as well. But refund opportunity is based on the dollars that are left over in your claims pre-funding bucket when the runover period is complete. So unlike traditional fully insured plans for small employers, particularly in the ACA space that have 50 or less FTEs, level funded groups not only have refund opportunity, but they also receive more transparency into how their healthcare dollars are spent. So this allows them to monitor their claim costs and their group performance throughout the year. Who is a level funded plan for? Most carriers will offer level funded plans for employers with anywhere from 5 to 10 enrolled employees up to a max of around 100 enrolled employees. And employers that are considering level funded are generally those that are healthy employer groups, usually in the ACA space, the grandfathered space, or the transitional space, and are looking for options outside of the ACA. It could also be smaller, large groups that are looking for that stepping stone into self-funding while maintaining some of the elements of a fully insured plan, such as that fixed monthly cost. Employers considering level funded should have a generally healthy workforce, and this is extremely important for risk management purposes because level funded groups are medically underwritten. The expected claims costs are determined based on the age and health of the employees enrolling in the plan. So a healthier workforce means a lower monthly cost, less overall risk for the employer, and a greater possibility for refunds at the end of the runout period. So let's dig into how level funding works. There is a fixed monthly cost, as I had mentioned before, and that consists of 3 categories, and you'll see those on the screen. So the first one is your administration costs. These are the estimated costs to administer the plan. Then you have your stop loss coverage. This could include specific and aggregate stop loss, and I'll get into those specifics in just a moment. And this helps to provide protection against any catastrophic losses or large claims. Then you have the maximum claims pre-funding bucket. This is the maximum dollar amount that the employer sets aside to pay for claims throughout the course of the plan year. And this amount is based on the health of the group through medical underwriting. So that's where the healthier employer population comes into play. You want to make sure that the health of your group runs well enough so that you can estimate the claims pre-funding bucket. Then all 3 of those items consist of your fixed monthly cost. So that is the amount total that you would pay every single month to help pay for those claims and administer your plan. Taking a deeper dive into stop loss coverage, which is one of the elements of your fixed monthly cost, this is an essential factor for the level funded arrangement. Stop loss limits the employer's financial responsibility for claims over a certain amount, and that can be either on a per employee basis or for the entire covered population. Individual stop loss provides protection for the employer against a high claim on any one individual. And this includes protection against that abnormal severity of a single claim. You can see the example on the screen. That could be anywhere from $10,000 to $20,000 that offers that protection. Then you get into aggregate stop loss, and this is a ceiling on the dollar amount of eligible expenses that an employer would pay in total during the contract period. So if your total claims would exceed that aggregate limit, anywhere from 120 to 125%, then your stop loss coverage kicks in and covers those additional claims costs. On a self-funded plan, stop loss coverage is available for purchase, and employers pay extra for this insurance. So with self-funding, no premiums are paid to the health insurance carrier, and employers only pay for that admin fee to help administer the plan. Let's dig into the refund opportunities with level funded plans and an added incentive when choosing this type of coverage. After the plan year is over and the run-out period is complete, any unused dollars in the claims pre-funding bucket are eligible for a refund. So if you take a look at the example on the screen, at the beginning of the plan year, if the health carrier estimates you need to set aside $120,000 for annual claims pre-funding, at the end of the plan year and the run-out period, the group used $95,000 in the maximum claims pre-funding, which means they have $25,000 in unused dollars at the end of the run-out period. The group's refund depends on the health carrier's refund requirements, but is generally anywhere from 60 to 100% of the unused dollars. So in this example, the employer group would get $15,000 to $25,000 back in a refund because of their performance for that plan year. Most health insurance carriers do offer a variety of narrow or broad network options, and it would include options for employees that reside outside of any given carrier service area. Design options could be preset, or the employer may be able to choose the deductible, copay, out-of-pocket limits that work best for their employees. But rest assured, all carriers have a variety of traditional and health savings account, or HSA, high deductible health plans to choose from. And with level funded, many health insurance carriers will offer extras to help employees manage their health care. This could include 100% coverage for preventive care, virtual services that can connect individuals to providers that can diagnose, treat, and prescribe, It could also include online tools to help them manage their claims and out-of-pocket costs. And then individuals may also be equipped with step-by-step support with care management or utilization management related services. If you are interested in learning more about Security Health Plan's level-funded plans, our sales team contact information is on the screen, and we also have a website dedicated for you to learn more about these plans as well. So you can check that out online. And with that, that is the end of my little tutorial on LevelFunded. So look to Jeff and Kara if there are questions that anyone has out there to answer.
I have to look to, usually I get the questions from Ashley. And Ash, do we have any questions that have come in?
Actually, Jeff, we do not. I've been watching it pretty diligently here, and we haven't had anything come in yet.
Okay, can I ask some then?
Absolutely, yeah.
This is actually my first. I've heard I work closely with Security Health, but I'm not involved in that side of things, and so I love learning about these products. And so if you cover this, I apologize, I missed it. But how long have these been available to employers?
Level-funded plans have been around for an extremely long time. They've become more popular with the ACA and the small employer space, and particularly those employers that are looking for alternatives to the ACA. ACA plans are community rated in the small group space, so very different from level-funded, because level-funded is medically underwritten. So if you have a generally healthy workforce, you may save some dollars in your monthly costs, and you have that opportunity for refunds, whereas unlike the ACA, you're community rated and you may have higher premiums because the risk is based on the overall pool of the small employers that are part of that health insurance plan.
And so do you see employers becoming more active in terms of health coaching and wellness type programs and programs to, I guess, just help their employees become healthier and more educated and that sort of thing as a result? It feels like they have more skin in the game in this kind of a product.
Yeah, they definitely have more skin in the game with this type of product. I think they also have that increased transparency that I spoke about as well. So they can monitor the overall performance of their group. That is a huge bonus with LevelFunded when you compare it to the ACA, where you really don't have that transparency on the overall performance of your group. And so I would definitely encourage employers to get more interactive with the wellness programs and other initiatives to help their members control their costs. And there are some level-funded plans out there that will help you do that with some of the perks that I had mentioned earlier.
Erin, Jeff, you don't mind me interrupting. You've sparked some excellent questions coming through here. So I just want to take a moment to shoot these past you, Erin. The first one, how do you determine if you have a healthy employee group or not?
Yeah, that's a great question. So I think
I'd be happy to take that one, actually, if you don't mind, since our sales team works so closely with folks on this.
Yeah, that would be great.
Yeah.
Yep.
So when we take a look at determining whether the group is healthy or not, just like a fully insured group, we would need some form of medical history or medical experience. And we can do that a few different ways. One is using pharmacy data to determine the health of the group. We use a tool called Curve through Milliman to do that. In order to get that set up, we would need a full member census, so not just the employees, but employees and their family members that would be taking coverage, as well as a few other items that are required for quoting. And you can contact our account management team and they can help you get those documents collected to do that. If we don't use Curve, we can also use medical applications. I know that's a That's a tough pill to swallow. Those are long applications. Employees usually don't enjoy filling them out. And I know you guys have to kind of chase them down to get them in, but that is an alternative that we can use as well to help price the group. Because of the size of groups, we don't usually see claims experience come through, but if for some reason they have 24 months of claims experience, we could also make that work to help price the group and find out where their health is based on their essentially where we're seeing the high cost claims or high cost prescriptions coming in. And you'd work closely with one of our account managers who would then work with you to help you understand what's impacting the group or might impact the group when it comes to level funding. The next question is, what is a percentage claim rebate? What percentage claim rebate does Security Health Plan pay?
Yeah, so right now the refund opportunity is 66% of those unused claim dollars at the end of the runout period.
Thank you. And then our next question, I'm not clear on the difference between self-funding and between a self-funded plan and a level-funded plan.
Sure. So, yeah, a level-funded plan is truly that hybrid approach. So you have some of the consistent things like a monthly cost that you would pay in a fully insured plan. And with self-funded, you're responsible for paying all of the claims costs. You just pay the admin fee to the carrier to help administer the plan. You are also on the hook for purchasing your own stop loss coverage, which with a level funded plan is all built into that monthly cost. And so with a self-insured plan, you are truly taking on all of the risk of the population that you are administering the plan for. With level funded, there's limited financial risk because you have that stop loss coverage built into play, and it's all a part of that monthly cost that you pay the health insurance carrier to not just administer, but help pay your claims and administer that stop loss coverage on your behalf.
Thanks. Thanks, Erin. The other thing that's different is when it comes to the benefit design. On a self-funded plan, the employer really is the carrier, and in that case, they can, or essentially they're the carrier, so they can design the benefits, what's covered, what's not covered, as long as it meets ERISA and ACA guidelines related to self-funded. Whereas on the level-funded plan, what's covered and not covered is set by the carrier offering the level-funded plan. So you'll find if you use Security Administrative Services for self-funding and administration, we work with you to design the benefits the way you want them administered. Whereas on a level-funded plan, it is a set certificate or a set SPD essentially that lays out what is covered and not covered, and there's really no variation from that.
Right, and with Security, we have 12 preset plan designs per network option. So I'd mentioned some carriers provide you with the option of picking your own deductible and out of pockets and things of that nature. We have preset plan designs, so we take a little bit of that out of the game and just provide you with the plans that you can pick from based on your network option.
Thank you. And then our last question I'm seeing here, can you set different stop loss amounts for each?
Yeah, so that likely varies by carrier. With Security Health Plan, our individual stop loss limits are based on the number of contracts. So if you have 10, I think it's 10 to 25, the individual stop loss is set at 10,000. 26 to 50 is 15,000, and then 51 up to 100 is 20,000. And then our aggregate is set at 125. Other carriers may be different. You may have you may or may not be able to pick those.
Thank you, Erin. And that's all the questions that I have from the group today, or right now.
And one more that came in, Kara.
Yeah.
And the question is, how is stop loss premium determined?
Well, thank you.
Yeah, so that's going to be a one of the buckets of your total monthly cost. To be honest, I leave that to medical underwriting, so I couldn't tell you all of the logistics of how the stop loss premium is determined based on the underwriting process. I don't know, Kara, if you would have more insights on that. Otherwise, we can definitely follow up.
Sure, Erin. So when we take a look again at that experience, whether it's coming in through our curve system or medical applications, underwriting looks at it similar to how they would look at a large fully insured group, and base it on that health and the experience. The stop loss carrier that we work with also takes a look at our proprietary discounts with some of the local providers that we have in our network. So when they're pricing their stop loss, they take that into consideration and how much the group is going to see in savings because of those. And so that's what goes into the calculation and the pricing at a very high level.
Did have another question.
That's the end of our.
I had one more come in. Sorry, I was going to chime in really quick before we exit the call, but one question that was just submitted was, for the 100 count, is this just employees enrolled, or do you include family members covered?
Yeah, the 100 is focused on anywhere from 10 to 100 employees enrolled for security.
Excellent. Thanks, Erin. And I think that ends our questions for today. Again, really appreciate you joining us on our webinar Wednesday. We hope to see you again as we introduce more unique products out into the market. And for those of you on the phone, if you would like to quote a LevelFunded plan for one of your clients or one of your prospects, please don't hesitate to give us a call. We're one of many carriers out there that offer this. I feel we're the best, but I'm a little biased. You can see our sales phone number up there on the screen, but I know many of you know our sales team. Just feel free to reach out to the folks you know, and we'll help get you started. All right. Well, thanks everyone, and have a wonderful day.
Thank you.
Bye, all.
Take care.